What is the normal hepatitis B surface antibody range? I'm Dr. Bhargav Raut from Pathofast Lab Pune, and we do this test at our lab, and I'm going to tell you what the different normal ranges are and what they mean. So the hepatitis B surface antibody is our body's defense system against the hepatitis B virus. In those people who have received vaccinations against the hepatitis B virus, or in those people who have had the infection and have successfully cleared off the infection by fighting against it through their immune system, in both these kinds of people, you are going to find an increased or higher level of the hepatitis B surface antibody. But what is the normal range? So the normal ranges are actually of 4 types. The first is those people who have never been infected with hepatitis B and who have never received the hepatitis B vaccine. Their normal expected range should be around 0. The literature says that anything less than 8.5, that means 0 to 8.5, is considered to be negative. But if someone has never had the infection and has never been vaccinated, your level should be 0. There is no reason to see this antibody in your blood in that case. Now let's go to the second situation. Let's say that you received the vaccine for hepatitis B. So the vaccine normally has 3 doses, and let's say that you've taken all the 3 doses of the vaccine. So what should your level be? Well, according to the American guidelines, your level should be more than 10, or at least more than 10, or very close to 10. So a level more than 10 implies that your vaccination was successful and that the level of the antibodies is now enough to fight off the infection if it should ever enter your body. So a level between, now let's go to the third situation. Let's say that you were infected by hepatitis B in the past. Even in this case, we normally expect that your antibody level should be more than 10. Most patients will definitely show a higher level than this if they have successfully cleared off the virus. So it depends on whether you cleared off the virus or not. If you cleared off the virus, we expect your antibody level to be more than 10. Now there is a fourth situation, which is a gray area, where patients have a level between 8.5 and 10. And that is considered by the American guidelines to be a sign of either inadequate vaccination or a poor immune response. And in either of these cases, we say that you should get yourself retested after a couple of weeks, because this is a gray area. Less than 8.5 would mean that you don't have adequate protection. More than 10 would mean you have adequate protection. But between 8.5 and 10, it's a gray zone, it's a no man's land, and you need to get retested. So the takeaway from this video should be that if you were never infected and never vaccinated, your level should be at 0. If you were vaccinated or infected and you don't have the virus anymore, we expect your level to be more than 10. Anything between 8.5 and 10 is considered to be no man's land, and you should get yourself retested. Thank you.